Here are 100 commonly asked PNLE-style multiple-choice questions A to D. After the 100 questions, I give an answer. Key with concise explanations for each item. Use this as a practice test. Try to answer all 100, then check the answers and rationales at the end. One. A nurse is delegating to a nursing assistant. Which task is appropriate to delegate? A. Interpreting vital sign trends and adjusting oxygen flow. B. Administering the morning oral medications. C. Assisting a stable patient with ambulation to the bathroom. D. Performing initial admission nursing assessment. 2. The most appropriate action when finding an unconscious client unresponsive is to check for a pulse and call a code if no pulse. B. Leave the client and search for the physician. C. Place the client in Trendelenburg position. D. Give oral fluids. 3. Hand hygiene with alcohol-based rub is contraindicated when A. Hands are not visibly soiled. B. Caring for patients with clostridioides, difficile infection. C. Before putting on gloves. D. After contact with patient's intact skin. 4. The best way to prevent medication errors is to A. Administer medications quickly to save time. B. Follow the 5 rights of medication administration. C. Rely on memory for frequent medications. D. Ask family members about usual doses. 5. A client refuses a nursing procedure. The nurse should A. Explain the reasons and then force the procedure. B. Document the refusal after the client leaves unit. C. Respect the refusal, explain risks, and document it. D. Call security to enforce treatment. 6. The correct site for intramuscular injection in an adult is a dorsogluteal for all adults routinely. B. Deltoid for infants under 6 months. C. Vastus lateralis for infants and toddlers. D. Intradermal at the mid-forearm. 7. When caring for a client with droplet precautions, the nurse should wear A. N95 respirator only. B. Mask and eye protection within 3 feet of the patient. C. No mask but gloves are required. D. Full airborne isolation room always. 8. A nurse finds a fire in a patient's trash bin. First action is to A. Extinguish the fire, ignoring alarms. B. Rescue patients in immediate danger, then alarm, then confine, then extinguish. RACE. C. Remove other staff and then call the doctor. D. Open windows to ventilate smoke. 9. Best method to reduce hospital-acquired pressure ulcers is to A. Keep patient in bed and avoid movement. B. Reposition at least every 2 hours and use support surfaces. C. Increase caloric intake only. D. Apply alcohol to bony prominences. 10. A client with signs of orthostatic hypotension should be instructed to A. Stand up quickly after lying down. B. Dangle legs first, then rise slowly. C. Avoid sitting up at all costs. D. Drink caffeinated beverages before standing. 11. A nurse discovers medication prepared by another nurse on the medication card that looks incorrect. The nurse should A. Administer as prepared. It is not the nurse's responsibility. B. Confront the colleague publicly and then administer. C. Verify the order and consult the prescriber before administering. D. Dispose of the medication. 12. Best position for a client with difficulty breathing and orthopnea is A. Supine with legs elevated. B. High Fowler's position, sitting upright. C. Prone position. D. Trendelenburg. 13. For safe patient transfer from bed to chair, the nurse should A. Use proper body mechanics and ask for assistance when needed. B. Lift using back muscles only. C. Twist while lifting to speed up the process. D. Ask patient to hold the nurse's neck. 14. Which sign indicates inadequate pain control in a post-operative child? A. Sleeping quietly. B. Running a fever only. C. Increased heart rate, irritability, and decreased appetite. D. Talking and playing normally. 15. A nurse teaching proper inhaler use should tell the client to A. Inhale quickly and forcefully at the same time as pressing the canister. B. Exhale into the inhaler before inhalation. C. Hold breath for 1 to 2 seconds only after inhaling medication. D. Use 2 inhalers at once for better effect. 16. When suctioning an endotracheal tube, maximum suction time should be a 30 to 60 seconds continuously. B. 15 seconds per suction pass with pre-oxygenation. C. No limit. Suction until secretions are clear. D. 5 minutes. 17. A client is scheduled for surgery and signs the consent form, but later says they do not want the operation. The nurse should A. Notify the surgeon and document refusal. B. Explain that consent has already been given and proceed. C. Call security to restrain the client. D. Remove the consent form. 18. The best way to prevent catheter-associated urinary tract infections is to A. Irrigate the catheter daily. B. Maintain a closed drainage system and remove catheter as soon as possible. C. Replace catheter every 2 days. D. Use cotton packing around the meatus. 19. A nurse caring for a client with congestive heart failure should monitor for a hypotension only. B. Signs of fluid overload such as edema and crackles in the lungs. C. High urine output always. D. Diminished breath sounds only in lower lobes. 20. When documenting in the patient record, the nurse should A. Use vague terms like patient stable without details. B. Chart only positive outcomes and omit problems. C. Record factual, objective data, time and signature. Correct errors per policy. D. Erase errors and rewrite entries to look neat. 21. A client with hyperkalemia is at risk for a hypotension only. B. Cardiac dysrhythmias such as peaked T waves and ventricular fibrillation. C. Bradycardia only without ECG changes. D. Increased urine output. 22. Priority for a client with chest pain and suspected myocardial infarction is to a schedule for an exercise ECG later. B. Administer oxygen, obtain electrocardiogram, and give aspirin per protocol. C. Give oral analgesic and send home. D. Encourage deep breathing and coughing. 20. Tiasa. 23. A patient receiving heparin infusion should be monitored for A. Increased platelet count only. B. Signs of bleeding and A. PTT levels. C. Hyperglycemia. D. Elevated potassium. 24. A post-operative client has shallow, slow respirations and pinpoint pupils. The nurse suspects hypovolemia. B. Opioid overdose and should administer naloxone per protocol. C. Air embolism. D. Anxiety attack. 25. A client with pulmonary embolism most likely reports a gradual onset of cough with green sputum. B. Sudden pleuritic chest pain, dyspnea, and possible hemoptysis. C. Low fever for several weeks only. D. Leg cramps only. 26. The best indicator of effective fluid resuscitation in hypovolemia is A. Immediate drop in body weight. B. Increased urine output and improved vital signs. C. Increased hematocrit. D. Decreased breath sounds. 27. For stroke CVA suspected, the nurse must A. Wait for physician order to assess neurological status. B. Perform a rapid neurologic assessment and note time of symptom onset for thrombolytic eligibility. C. Give aspirin immediately to all stroke patients regardless of type. D. Elevate the head of bed to 90 degrees. 28. Client with diabetic ketoacidosis. DKA nursing priority includes a. Restrict ING fluids. B. Rehydration with intravenous fluids, insulin therapy, and monitoring electrolytes. C. Giving oral hypoglycemics only. D. Withholding potassium forever. 29. A patient with acute pancreatitis should be given a high-fat diet to stimulate pancreatic function. BNPO status. With intravenous fluids and pain management initially. C. Immediate oral feeding of solid foods. D. Laxatives. 30. Which lab value indicates renal impairment? A serum creatinine 1.0 milligrams per deciliter in adult male. B. Creatinine clearance decreased and serum BUN and creatinine elevated. C. Fasting blood sugar elevated only. D. Hemoglobin elevated. 31. A client with iron deficiency anemia will most likely have A. Increased ferritin and red blood cell indices normal. B. Low hemoglobin, low MCV, microcytic, and low ferritin. C. High MCV and hypersegmented neutrophils. D. Elevated serum iron always. 32. Best nursing action for hypoventilation with rising carbon dioxide is to A. Encourage slow, shallow breaths. B. Assist with bag valve mask ventilation or call respiratory therapy and support airway. C. Place in Trendelenburg position. D. Give oral bronchodilator only. 33. A client with chronic obstructive pulmonary disease, COPD, should be taught to A. Use pursed lip breathing to decrease air trapping. B. Breathe rapidly through the mouth only. C. Avoid inhalers altogether. D. Sleep with several pillows to avoid breathing. 34. Indication of wound infection in a surgical incision is a clean, dry edges only. B. Purulent drainage, redness, warmth, and increased pain. C. Absence of any drainage. D. Slight separation that closes spontaneously. 35. A client on warfarin therapy should be taught to A. Eat a lot of leafy greens without changing Indian rupee monitoring. B. Keep consistent vitamin K intake and monitor INR regularly. C. Stop all medications when feeling well. D. Drink grapefruit juice daily to help INR. 36. Best position to promote drainage after tonsillectomy is a supine with head flat. B. Side lying or prone to allow drainage and reduce aspiration risk. C. Trendelenburg always. D. Upright with neck hyperextended. 37. The cause of metabolic acidosis with an increased anion gap includes A. Vomiting only. B. Lactic acidosis, ketoacidosis, or toxin ingestion, for example, methanol. C. Hyperventilation. D. Excess bicarbonate ingestion. 38. A patient with new onset atrial fibrillation is at risk for A. Hypoglycemia only. B. Thromboembolism, stroke, so anticoagulation may be considered per risk assessment. C. Immediate hypotension only. D. Dehydration only. 39. Which sign indicates hypoglycemia in an adult? A. Dry, warm skin and polyuria. B. Diaphoresis, shakiness, confusion, and tachycardia. C. Gradual weight gain only. D. Hyperreflexia only. 40. First priority in caring for a newborn immediately after birth is to A. Bathe the baby immediately. B. Initiate drying, warm the infant, clear airway if needed, and provide skin-to-skin contact. C. Feed glucose water immediately. D. Give antibiotic eye ointment only. 42. Signs of preeclampsia include A. Hypotension and bradypnea. B. Hypertension and proteinuria after 20 weeks gestation. C. Early first trimester spotting only. D. Hyperthyroidism. 43. The best position for a woman with supine hypotension syndrome is a flat on back with legs elevated. B. Left lateral tilt to relieve pressure on inferior vena cava. C. Trendelenburg fully flat. D. Right lateral tilt always. 44. Normal fetal heart rate range in a term newborn is a 60 to 80 beats per minute. B. 110 to 160 beats per minute. C. 200 to 220 beats per minute. D. 40 to 60 beats per minute. 45. Teaching a breastfeeding mother. Correct latch includes A. Only the nipple in the infant's mouth, areola not included. B. Wide open mouth with both nipple and much of areola drawn into the mouth. C. Baby's chin away from breast. D. Rapid shallow sucks only. 46. A 2-month-old infant with dehydration will likely show a normal anterior fontanelle and moist mucous membranes. B. Sunken fontanelle, decreased urine output, dry mucous membranes, and lethargy. C. Bulging fontanelle only. D. Excessive urine output. 47. The most common sign of child abuse to suspect is A. Any injury without plausible explanation or inconsistent history. B. Simple scrape while playing explained by child. C. Presence of a bruise during sports. D. Seasonal allergies only. 48. During labor, late decelerations on fetal monitoring indicate a normal fetal heart rate pattern. B. Uteroplacental insufficiency and fetal hypoxia. Intervene immediately. C. Fetal sleep cycles only. D. Maternal bradycardia only. 49. Best management for postpartum hemorrhage due to uterine atony is A. Immediate uterine massage and uterotonics, for example, oxytocin. B. Place patient on bed rest and observe only. C. Delay intervention for 24 hours. D. Give only oral analgesics. 50. A newborn with jaundice in the first 24 hours of life suggests a physiologic jaundice only. B. Pathologic jaundice, possible hemolysis or blood group incompatibility, requiring prompt evaluation. C. Normal and needs no evaluation. D. Always due to breastfeeding. 51. Best time to initiate breastfeeding for the newborn is A. Within the first hour of life, early skin-to-skin and feeding. B. After 24 hours only. C. After first bath. D. When mother feels comfortable later in the day. 52. A pregnant client on magnesium sulfate therapy should be monitored for A. Decreased deep tendon reflexes, respiratory depression, and decreased urine output at toxic levels. B. Increased reflexes only. C. High blood sugar only. D. Increased respiratory rate. 53. For newborn thermoregulation, appropriate action is to place directly under air conditioning to cool the baby. B. Dry, place skin to skin with mother, and use warm blankets or radiant warmer if needed. C. Immerse in warm water immediately. D. Avoid covering the head. 54. A mother with mastitis should be taught to A. Stop breastfeeding immediately. B. Continue breastfeeding frequently, apply warm compresses, and seek medical treatment if needed. C. Only express milk and discard it forever. D. Use ice only, no feeding. 55. The correct immunization given at birth in the Philippines is a measles vaccine, B. BCG, and hepatitis B vaccine, depending on policy. C. MMR only. D. Varicella vaccine. 56. A 7-year-old child with acute asthma attack has wheezing and accessory muscle use. Priority nursing action. A. Administer inhaled bronchodilator short-acting beta-2 agonist and assess oxygenation. B. Give oral antibiotics. C. Start corticosteroids only after 2 days. D. Restrict fluids. 57. Signs of dehydration in toddlers include A. Increased skin turgor and moist mucous membranes. B. Dry mucous membranes, decreased tears, decreased urine output, and poor skin turgor. C. Bradycardia only. D. Excessive salivation. 58. A neonate with low birth weight is at increased risk for A. Hypothermia, hypoglycemia, and infection. B. Only increased height growth. C. Older adult type illnesses. D. No special risk. 59. The best way to prevent mother-to-child transmission of HIV is A. Ignore maternal HIV status. B. Provide antiretroviral therapy to mother during pregnancy and appropriate prophylaxis to the newborn and counsel on feeding options. C. Always advise breastfeeding without medication. D. Deliver at home unsupervised. 60. For a child with suspected meningitis, immediate nursing priority is A. Start isolation precautions, obtain cultures, and administer antibiotics promptly. B. Give aspirin and send home. C. Wait 24 hours for culture results before treatment. D. Only give antipyretic at home. 61 to 80. Community health, public health, epidemiology. 61. The primary prevention strategy in public health is to A. Early diagnosis and treatment of disease. B. Prevent disease occurrence, for example, immunization, health education. C. Rehabilitation after illness only. D. Palliative care only. 62. Notifiable diseases must be A. Kept confidential and never reported. B. Reported to public health authorities per local regulations to control outbreaks. C. Reported only at year-end summaries. D. Handled by family only. 63. A community needs assessment. First step is to A. Implement interventions directly. B. Collect and analyze data to identify community health needs and resources. C. Hire more physicians only. D. Begin mass immunization immediately without assessment. 64. Herd immunity threshold helps to A. Make everyone susceptible to disease. B. Reduce transmission when a sufficient proportion of the population is immune. C. Increase incidence of infections intentionally. D. Replace vaccination programs. 65. The best way to measure nutritional status in children at community level is a head circumference only in adults. B. Use growth charts, weight for age, and weight for height measurements. C. Measure BMI only in infants. D. Visual inspection only. 66. Waterborne disease prevention in a community includes A. Ensuring clean water supply, proper sanitation, and health education. B. Ignoring water treatment altogether. C. Only focusing on vector control. D. Encouraging open defecation. 67. The most effective measure to control an outbreak of measles is A. Antibiotic therapy for all exposed persons. B. Mass vaccination of susceptible individuals and isolation of cases. C. Give antiviral drugs to everyone. D. Close all hospitals only. 68. In contact tracing, the primary goal is to A. Punish those who are infected. B. Identify exposed persons, inform them, and help prevent further spread through testing and/or prophylaxis. C. Only collect names without follow-up. D. Publicly release personal data. 69. The key component of DOTS for TB control includes A. Intermittent and unsupervised therapy only. B. Directly observed treatment, short course. Supervised therapy to ensure adherence. C. No treatment, only isolation. D. Surgical removal of lungs. 70. The role of the community health nurse in disaster preparedness includes a planning, education, early warning, and helping coordinate response and recovery efforts. B. Waiting for disaster to occur and then reading textbooks. C. Providing only administrative paperwork. D. Only treating injuries after 6 months. 71. A common vector control method for dengue prevention is A. Removing standing water and breeding sites and community education. B. Encouraging mosquito breeding to build immunity. C. Spraying antibiotics into water sources. D. Feeding mosquitoes to predators only. 72. When performing a windshield survey, the nurse observes community features by A. Conducting lab tests only. B. Driving or walking through the community to observe housing, services, safety, and resources. C. Only asking hospital staff about the community. D. Only reading news articles. 73. Effective health education should be A. Complex and full of jargon. B. Culturally appropriate, clear, and tailored to the audience's literacy level. C. Delivered only in written form, regardless of audience. D. Punitive in tone. 74. The epidemiologic term incidence refers to a number of existing cases at a point in time. B. Number of new cases occurring in a defined period of time. C. Total population size only. D. Mortality rate only. 75. Screening program is effective when the disease A. is rare and has no treatment. B has a detectable preclinical phase and effective treatment is available. C cannot be detected early. D only affects animals. 76. In school health programs, the nurse's role includes A. Only administering medications without assessments. B. Health screening, immunizations, health education, and referrals. C. Teaching only math and science. D. Punishing students for poor health. 7. The best approach to reduce smoking prevalence in a community is A. Increase tobacco marketing only. B. Implement tobacco control policies, public education, and cessation support. C. Encourage youth to try cigarettes. D. Ignore the issue. 78. Maternal mortality ratio is best reduced by access to skilled birth attendants, emergency obstetric care, and prenatal care. B. Avoiding antenatal visits entirely. C. Only traditional healers without medical backup. D. Ignoring complications. 79. When planning a community immunization drive, priority is to A. Advertise widely, ensure adequate vaccine supply, cold chain, and trained staff. B. Open without vaccines and ask people to return later. C. Only vaccinate administrative staff. D. Avoid cold chain concerns. 80. A nurse teaching safe water storage at home should recommend A. Storing water in open containers outside. B. Using covered clean containers and treating water if needed, boiling or chlorination. C. Sharing water containers with animals. D. Adding sugar to water to preserve it. 81 to 90. Mental health, psychiatric nursing. 81. A priority nursing intervention for a client with suicidal ideation is to promise confidentiality and do nothing else. B. Ensure client safety, remove means, conduct risk assessment, and involve psychiatric services. C. Ignore statements and assume it is a cry for attention only. D. Give sleeping medication only. 82. For a client experiencing acute psychosis, the nurse should A. Argue with delusions to prove they are false. B. Provide a calm environment, use simple, clear communication, and ensure safety. C. Leave client alone unattended for long periods. D. Increase stimulation to distract them. 83. A hallmark of major depressive disorder includes A. Persistent depressed mood and loss of interest or pleasure for at least 2 weeks with functional impairment. B. Always elevated mood and increased energy. C. Only occasional sadness lasting hours. D. No change in sleep or appetite. 84. When administering antipsychotic medications, the nurse should monitor for A. Neuromuscular side effects such as extrapyramidal symptoms and tardive dyskinesia and metabolic changes. B. Only blood glucose increase. C. Immediate cure of psychosis without side effects. D. Hypersalivation only and nothing else. 85. For anxiety management in acute panic attack, immediate nursing action is A. Leave patient alone to get over it. B. Stay with patient, provide reassurance, and use slow breathing techniques. Medication as ordered. C. Increase caffeine intake to calm them. D. Force them to run to expend energy. 86. Cognitive behavioral therapy, CBT, focuses on changing cognitions and behaviors to reduce dysfunctional patterns. B. Only family therapy without addressing thoughts. C. Ignoring thought patterns and focusing only on medication. D. Long periods of silence without interaction. 87. In bipolar mania, a common nursing concern is a risk of injury due to hyperactivity, poor judgment, and decreased need for sleep. B. Only weight loss without behavior changes. C. Persistent inactivity only. D. Complete amnesia only. 88. Priority for a client with alcohol withdrawal is a monitor for withdrawal severity, for example, delirium tremens, provide thiamine, and manage symptoms with medications per protocol. B. Encourage drinking more alcohol to prevent withdrawal. C. Avoid monitoring and wait for seizures to occur. D. Give only antibiotics. 89. A client with schizophrenia hears voices telling them to harm others. Nurse's first action: A. Immediately remove access to means and ensure safety of client and others. Notify team psychiatry. B. Encourage acting on command hallucinations. C. Ignore and continue routine care. D. Tell client that voices are real and to obey them. 90. When a patient becomes aggressive, the least restrictive intervention is A. Immediate physical restraint without attempts to de-escalate. B. De-escalation techniques, verbal calming, and offer options before considering seclusion or restraint. C. Sedate first without trying communication. D. Encourage patients to act aggressively to release tension. 91 to 100. Pharmacology, miscellaneous. 91. A nurse should question a prescription for acetaminophen if the patient already received A. No other medications today. B. A combination product that contains acetaminophen and total daily dose is approaching or exceeding 4,000 milligrams or facility policy limits. C. Only ibuprofen and no acetaminophen. D. Topical antibiotic only. 92. The antidote for acetaminophen overdose is naloxone. B. N-acetylcysteine, NAC. C. Vitamin K. D. Flumazenil. 93. A client on aminoglycoside antibiotics, for example, gentamicin, should be monitored for A. Nephrotoxicity and ototoxicity, hearing loss. B. Only hypoglycemia. C. Increased platelet count only. D. Joint pain only. 94. A 70-kilogram adult requires a medication dosed at 2 milligrams per kilogram. The correct dose is 35 milligrams. B. 140 milligrams. 70 milligrams. 200 milligrams. 95. A nurse teaching about insulin administration tells the client that rapid-acting insulin should be given 30 to 60 minutes before meals. B. Immediately before or with meals, as it acts quickly. C. Once weekly only. D. At bedtime only, regardless of meals. 96. A client receiving digoxin should be monitored for toxicity if A. Serum potassium is normal and heart rate is above 70. B. Serum potassium is low and the patient has nausea, visual disturbances, yellow halos, and bradycardia. C. Only if patient is hypertensive. D. If the patient has headache only. 97. An important nursing consideration for opioid analgesics is to A. Ignore respiratory rate. B. Monitor respiratory rate, sedation level, bowel function, and have naloxone available. C. Encourage alcohol use to potentiate pain relief. D. Stop monitoring after first dose. 98. A patient with allergic reaction showing hives and wheezing should receive A. Oral analgesic only. B. Epinephrine. IM, if anaphylaxis. Airway support, antihistamines, and close monitoring. C. Wait for symptoms to resolve spontaneously. D. Apply topical steroid only. 99. The correct disposal of unused controlled medications in the hospital should follow